Καλημέρα σε όλους, αγαπητοί συνάδελφοι και φίλοι. Η σημερινή ημέρα είναι αφιερωμένη στην ψυχική υγεία και το θέμα της φετινής Παγκόσμιας ημέρας ψυχικής υγείας είναι η ψυχική υγεία στον χώρο της εργασίας. Έχω λοιπόν την εξαιρετική ευχαρίστηση να εισηγηθώ τους σημερινούς ομιλητές. Πριν όμως από αυτό θα ήθελα να ευχαριστήσω ιδιαιτέρως τον κύριο Δημήτριο Βαρτζόπουλο, ο οποίος είναι ο υφυπουργός για την ψυχική υγεία στο Υπουργείο Υγείας και ο οποίος είναι συνάδελφός μας ψυχίατρος, την κυρία Ζωή Ράπτη, η οποία θα στείλει χαιρετισμό, έστειλε μάλλον χαιρετισμό προς την ημερίδα μας, τον καθηγητή κύριο Νίκο Παπαϊωάννου, ο οποίος είναι Γενικός Γραμματέας του Υπουργείου Παιδείας, και τον πρόεδρο του Ιατρικού Συλλόγου Αθηνών, τον Γιώργο Πατούλη. Κυρίως όμως θα ήθελα να ευχαριστήσω τους ομιλητές, οι οποίοι είναι εκλεκτοί από όλο τον κόσμο και μας έκαναν την τιμή να πάρουμε μέρος σε αυτή την ημερίδα. Θα μου επιτρέψετε να συνεχίσω στα αγγλικά, διότι το ακροατήριό μας είναι διεθνές. Επαναλαμβάνοντας αυτά που είπα προηγουμένως, I would like to thank the Deputy Minister of the Ministry of Health, Professor Dimitrios Vartopoulos, who has come to address the audience. Niki Kerameos, the Minister of Labor, Zoe Rapti, the Deputy Minister of the Ministry of Development, Nikos Papaioannou, Secretary General of the Ministry of Education, and George Patoulis, who is the President of the Athens Medical Association. I'm grateful to them, but I'm more grateful to the distinguished speakers who are going to take part in this session. Dr. Vartopoulos unfortunately has to go to the parliament because there's a meeting there. So I think he should start this meeting with an address to the audience.
Thank you, Professor.
One moment. There. Okay.
Thank you, Professor. Dear General Secretary, honorable professors, esteemed guests, ladies and gentlemen. World Mental Health Day, celebrated on the 10th of October each year, is an opportunity for all of us to reflect that no one facing any kind of mental health problems should feel alone. Mental health is a human right that demands for mental resilience, access to quality services, inclusive and stigma-free activities, freedom and the possibility to participate in all aspects of life, such as health, education, and of course, work. The global community celebrates today mental health in the workplace. Work should create existential satisfaction. Work should provide livelihood, meaning, and joy. However, many work environments in the whole world create unpleasant feelings, health problems, and, of course, unfortunately, exclusions. The Greek government supports mental well-being in the workplace and promotes a culture of inclusion and productivity with concrete measures. The responsible Ministry of Health implements actions on two main axes. First, using the Recovery and Resilience Fund, it created 4 employee support day centers, 3 in Athens and 1 in Salonika. These centers provide free services to employees who need support in managing any kind of mental health problems. Second, in our country, there is a good practice of labor rehabilitation since 2005, provided by the so-called social cooperatives of limited liability. There are in total 33 of them. They operate businesses which provide to people with severe psychosocial problems guaranteed and sheltered workplaces. In addition, the social cooperatives operate 5 specialized employment-seeking offices for people with severe illnesses. Implementing the law on the completion of psychiatric reform voted upon just 2 months ago, we will expand the network of these special offices throughout the country. So we are determined to strengthen and shield mental health in the workplace, ensuring our citizens modern quality services. Allow me to thank you for the opportunity to update you and to express my heartfelt congratulations on your event and work. Thank you.
I would like to thank Dr. Vatsopoulos for this address. And now we will follow the program, and the program includes a greeting from the representative of the Society of Preventive Psychiatry, Professor Nikos Christodoulou, who is going to speak on behalf of this society. Would you like to come to this place, because otherwise we will not be able to speak?
Okay. Let's do some chair dancing. Dear colleagues, esteemed guests, thank you for coming here today and honoring us with your presence. The theme of today's event is mental health in the workplace. But it is hard to visit that issue without thinking about what the role of mental health professionals and people who look after mental health in the society in general. I'm referring to politicians, policymakers, as well as people in the lay, as well as lay people. What is their role? It's difficult to identify that role, because if we look at morbidity of workers, of people in the workplace, it is a little bit too late to act. In fact, if we look at either morbidity, clinical morbidity in the workplace, or institutional morbidity in the sense of absenteeism or presenteeism and loss of productivity in the workplace, then that is too late to act. The only way to prevent this, the only way to prevent mental illness, the only way to prevent poor mental health as well as loss of productivity in the workplace, is by looking at things prospectively, and looking at things holistically, looking at things from the preventive point of view in the society, but also looking at things in the sense of supporting the public in their general health, general mental health. How do we do that, and how do we change our attitudes to achieve that? That is a bigger question that is existential for mental health professionals. And the question is this: do we contain our actions to everyday clinical practice, or do we extend our preventive actions and look into policy making in the sense that prevention is better than cure? And the answer, in order to not trivialize psychiatry and mental health in general, is to look at our wider role. And the wider role includes policymaking. It includes preventive measures. It includes public health. That existential problem for mental health professionals, in my view, is the issue that underpins today's meeting. I'm not going to extend this introduction further, so I'm going to just pass on the podium to the next esteemed speakers. Thank you for your time.
Ευχαριστούμε πολύ τον κύριο Νίκο Χριστοδούλου, τον καθηγητή. Εκ μέρους του Σωματείου Ελληνικό Δίκτυο Φροντιστών Επιών, θα ήθελα να σας καλωσορίσω και εγώ στον όμορφο αυτό χώρο του Γραφείου του Ευρωπαϊκού Κοινοβουλίου στην Αθήνα. Και χθες γιορτάσαμε την ημέρα του φροντιστή στην Ευρώπη. Θα ήθελα και σήμερα να τονίσω τον ρόλο των οικογενειών, συγγενών, φίλων, ατόμων με προβλήματα ψυχικής υγείας, που και στο κομμάτι της εργασίας παίζουν πολύ σημαντικό ρόλο. Σήμερα γιορτάζουμε την ψυχική υγεία στο χώρο εργασίας. Αυτό σημαίνει από το απλό στρες, το burnout, αλλά και τα άτομα με προβλήματα ψυχικής υγείας που θέλουν και αναζητούν μια επαγγελματική ένταξη. Και στα πλαίσια αυτά υπάρχει και η σημερινή συνάντηση του σχεδίου Sharing for Employment, που είναι ένα ευρωπαϊκό πρόγραμμα Erasmus+, που ανταλλάσσει καλές πρακτικές για την επαγγελματική επανένταξη ατόμων με ψυχική νόσο. Και όπως είπε και ο Υφυπουργός, υπάρχουν και στην Ελλάδα πλήθος καλών πρακτικών από κέντρα ημέρας που υποστηρίζουν την επαγγελματική επανένταξη ατόμων με ψυχική νόσο, ή και κέντρα ημέρας που υποστηρίζουν τους εργαζόμενους για την αποφυγή burnout και άλλων ψυχολογικών προβλημάτων. Σας ευχαριστώ πολύ και θα δώσω με τη σειρά μου τη σκητάλη στον κύριο Χριστοδούλου.
Λοιπόν, γεια σας και πάλι. I'm coming back to address the audience on behalf of the European Association of Professors Emeriti. But before doing that, I would like to thank the Office of the European Parliament in Greece, and especially Mrs. Eftalia Arvaniti and Mrs. Elvira Forte, who is next to me now, for the hospitality and the collaboration. Now, with reference to what I have to say on behalf of the European Association, it refers to the following. I think we should be careful in defining workplace, because the workplace is not as it was some years ago. It is not the factory anymore. It's not the mine with miners and workers in the sense that we're accustomed to. But it is now in a more advanced fashion. It is remote work, it's think tanks, it's management. So we have a broader perspective, which is necessary in addressing this issue. Another issue which is very important in my opinion, is that workplace does not refer only to paid work, but also to unpaid work, and especially with reference to the carers. Spiros Zorbas is the president of an association of carers, the Greek Carers Network of Epioni. These carers can be official, can be people who are paid carers, but most of carers are unofficial carers. The people who look after old people, the people who look after people with mental disorder, the people who look after incapacitated people. And these persons do not receive any salary. They're volunteers. And some of them sacrifice their lives in order to serve older people or incapacitated people. So this is the so-called forgotten workplace, about which Professor Sartoris is going to speak today, but also Spiros Zorbas will speak on this issue, and Dusic Alexis Tosevsky from Serbia. So we should view workplace in a broader perspective. More than half of the world's population work. Dear colleagues, ladies and gentlemen, is this work a blessing or is it a curse? 65% of employees identified work as number one stress in their lives. And 86% of the global workforce are struggling or suffering. And this is a work that has finished in 2024, this year. So in view of this, it sounds like work is more a curse than a blessing. Poor working conditions lead to chronic stress. George Krousos, Professor Krousos, is an expert in this, and he will talk on this later. We can cope with acute stress because of the axis that we motivate, the axis of the pituitary. It is composed of the hypothalamus, pituitary, and adrenals. This is all psychosomatic entities, all people have this axis to be able to face threats. So in the acute stress, we can cope. In chronic stress, when the stimulus is repeated again and again, every day, the same thing, this is chronic stress. And we cannot cope with this. We cannot cope with chronic stress. Whenever I talk about chronic stress, I'm reminded of the poet Kavafis from Alexandria, who said, «Η Ιθάκη σ' έδωσε το ωραίο ταξίδι, άλλο δεν έχει να σε δώσει πια. Ithaca has given you the beautiful journey. It doesn't have anything else to give to you». This is the organism, psychosomatic organism, which can't cope any longer under the influence of chronic stress. So this chronic stress leads to burnout, επαγγελματική εξουθένωση, burnout, about which Professor Papalexandri is going to speak. And we have two concepts here in work. We have the absenteeism and the presenteeism. What is absenteeism? Is to go away from the work and go home and try to relax or do something else. What is presenteeism, which is even more data? Presenteeism is to be present at work, but not do anything. Just sit there and have free associations and think about something else, not being productive. And this is the result of chronic stress. Dear friends, 15% of working adults have a mental disorder, mainly depression, anxiety, and stress. These are the three things that working people suffer from. And this leads, of course, to severe financial impact, has a severe financial impact. $1 trillion per year is lost because mainly of reduced productivity. It's not the hospitals, it's not the medication that is necessary for people with mental illness suffering from it because of the work stress, of the occupational stress. It is mainly loss in productivity. These people could be productive at work, but they are not. Why? Because of the conditions in work, the stress associated with it, the bullying in the workplace, the aggression and the violence in the workplace. But economic results of this situation are not so serious as is human suffering. People suffering from depression view death as something that is very much wanted, as a blessing. So this is a measure of what the effect of depression can be on people. Losing one's job on the other hand, leading to unemployment in fact, has equally dramatic consequences. There is nothing which is more associated with suicide than unemployment. So you see here that if you work under bad conditions, you suffer, you develop depression, you leave the work, and after leaving the work, this leads to unemployment. It's associated with leaving work. And then you have another evil, and this is killing oneself, suicide. So what can be done to turn curse to a blessing? That's to say, make work enjoyable or at least tolerable. The answer is listen to the working people, listen to the people who work. This is our task, this is our obligation. We should not design policies on paper without the opinion of workers. We should do research on this rather than guesswork. We should investigate rather than invent results. We should listen to the people rather than mislead the people in what you have in mind. And what do the people say? The people say the following: we want flexible work hours, we want time off, and it's not by chance that we have the expression, give me a break. Don't we say, please give me a break? Why do we say that? Because a break is necessary, a break in what you're doing. You have to be able to sit down, enjoy a cup of coffee, think, have free associations, talk to a friend, and so on and so forth. Have quality in your life. Then remote work is a demand of the working people. 4 days work, I don't know whether this is possible or not, but this is what they want. And they don't work monitoring. They don't want the big brother to watch them and see whether they're working. They don't want any bullying. They don't want any violence. And basically, they don't want violations of work-life balance. They should have 1/3 of their lives in sleep, 1/3 in work, and 1/3 in doing what they want to do. Enjoy life. Go for a walk. Go riding. Go climbing in mountains. Just sit in front of the television if they prefer. Have a conversation with friends. Enjoy the nature. Do whatever one wants to enjoy oneself. This is necessary. And it's necessary not only for happiness, but also for productivity. We should realize that in order for a person to be productive, he has to be happy in what he's doing. And I will end. Lydia Lazeri will talk on that in detail because she's very good in that. And I will finish with saying that exclusion of people with mental health problems from work should be abolished. We all know from research that people with mental problems who work can function, can be productive. They may be slow. Okay, they are slow, but they can function and be productive. Instead of losing your money in taking them to the asylum, you don't lose money, but you gain money if you give them an occupation. You should pay the employer, of course. The employer has to survive. So the employer has to get some money in order to have some people to work in the factory or wherever. Why do I say that? Because work is very basic for recovery. Recovery not in the medical sense, but recovery in the sense of being productive despite mental illness. The key word is despite mental illness to be productive. This is recovery. And in order to have recovery, you have to have employment. And I finish here because I think I have taken much of your time. Thank you very much. Right. Thank you very much for coming, Minister. So we go on with Mrs. Elvira Forte, who is next to me, and who is the representative of the Office of the European Parliament in Greece.
Thank you, Professor. And welcome and thanks to all of you who are here today. I was asked by the Professor Christodoulou to tell you a little bit about our building. So allow me to begin with a little history. We're welcome you here at the House of European Democracy in Greece, of the European Parliamentary Democracy, and this is the European Parliament Liaison Office in Greece. This is called the Mavromichalis Mansion. It's a building that was built around 1870. It passed from several prominent families of these years and prestigious families like Skilitsi family and Mavromichalis later. And at some point, it even worked as the residence of the Russian embassy, where the Russian ambassador, as the urban legend says, was a person who enjoyed a lot good life. So at this very hall that we are here today, it was the ballroom. And you can see there the little balcony that the orchestra was playing music, and you can imagine in the place of this table, people dancing. So besides the music chairs, we also had some different dancing throughout the years. During the dictatorship, and approximately around 1971, the Greek junta tried to sell this building and the land, but once again, the people saved this building, and a letter was initiated to the government to avoid this sale. And this was also thanks to Adonis Samarakis, Yannis Tsaroukis, and other personalities of that time that managed that this stays to the Greek, that this stays public. And it wasn't until 1991 that the European Parliament bought this building. And during the next 3 years, there were restoration works because the place that you see now is the original form, but it was transformed during the year. So we wanted it to be outside and inside as it was, closer to as it was at its original construction. So now we're proud and happy to work here and welcome interesting events like yours. So enough with the ancient history. Let's move a little to the more recent ones. It was like yesterday, exactly as yesterday, it was 4 months after the European elections of 9th of June, that 400 million European voters came to the ballots from the 27 member states of the Union and voted directly the representatives at the European Parliament. So as we speak today, 720 members of the European Parliament discussed in Strasbourg during the plenary exactly what you're here to discuss also, the importance of mental health in today's era. I'm sorry, I'm trying also to address the people on my right. So excuse me, but I'm asked to speak to the microphone here. So the MEPs also addressed the issue that you are going to address today about the mental health and the rise, as it is widely said, of mental health issues around ages and groups that wasn't so, they were not so familiar with this kind of situations. During the pandemic of COVID-19, it was also the Parliament and its special subcommittee SANT from Santé, which is the French word for health, that decided and urged the European Union and the member states to acknowledge the high percentage of mental health issues in our society and the connection not only with physical health, as they should be treated as equal issues, but also the connection with the rise of violence, harassment, bullying and cyberbullying, burnout at work, and also issues that were mostly mentioned between the youngest people from 18 to 34 years old. The lack of employment and financial or educational prospects, or on the other side, the burnout and the extreme hours of work, combined with loneliness and social isolation. I take an educated guess to say that these feelings are not completely eliminated after the pandemic. And this is an issue that the MEPs stayed most when they asked from the Commission to have a thorough EU health strategy for the years to come. And we are pleased that this is ongoing. So hopefully the next year we will have more concrete legislative work happening that will also help the governments deal with these issues in their member states. Let's not forget what the MEP said, that mental health is a fundamental human right. And this is important in Europe and the democracy that we live, because it's the only place in the world that we have a Charter of Fundamental Rights included since 2009 at the Convention of Lisbon, which is one of the basic of the fundamental law texts of the European Union. This means that it's not only something that the lawmakers should deal with, but it's their obligation to do so. And this is something that has also happened because of the pressure of people and of the society. Let's not forget that changes occur in three ways: education, demand of what's right, and lawmaking process. And this is something that we all, as citizens, have a say at this. So allow me to close with not, as I say, well, allow me to close with a little personal element connected to work, so that we understand that all of us have at times mental health issues. And it's not a shame to admit it. It's not something that knocks the door only of people who are next to us, but it knocks our door. And when this happens, we should ask for help. We should ask for help. And if you're not able to ask for help, and we know someone that is next to us that needs help, we can also tell to them that you're not alone and you can ask for help. So with my colleague that you mentioned, Efthalia Arvaniti, during the pandemic, when the directive for the balance between professional and private life was voted in the European Parliament, we were working really long hours from 7, 8 a.m. in the morning until 11 p.m. when the plenary was finishing, due to the new technical reality that the MEPs and all of us had to adjust. And when we translated and published the press release about this issue, that voted actually the right to disconnect. I remember Efthalia telling me around 10 p.m., and now it's time to practice what we have voted for and to actually disconnect. What I mean to say in my closing remarks is that it's difficult sometimes to let go of bad habits. And bad, I put it in a lot of quotes. That means that we have put ourselves in the situations that we believe that if we don't work long, or if we don't do and complete all our obligations at once, we are not good. We are not people worthy. We are not useful. This is a lie.
Okay.
So I give you the floor to continue
Continue. Yes.
with
Thank you
the
very
day.
much.
Thank you very much. On behalf also of the policy.
Ευχαριστούμε, Ελβετά.
Μετακινούμε σε άλλες εκδηλώσεις. Καλή συνέχεια. Ημερίδα σας.
Thank you very much, Mrs. Forte. The Forte is not by chance. So now we're going to show the video of Minister Nikki Karameos.
October 10th, World Mental Health Day provides an opportunity to discuss key topics related to well-being and mental health in the workplace, while also emphasizing the importance of maintaining a healthy and supportive work environment. Psychosocial risks and their consequences for mental and physical health represent some of the most pressing challenges in occupational safety and health. In the European Union, 27% of employees experience workplace stress or depression, while the proportion of workers reporting facing
Καλημέρα
risk
σε όλους,
factors
αγαπητοί
that can
συνάδελφοι και
adversely
φίλοι.
affect their mental health.
Η σημερινή ημέρα είναι αφιερωμένη στην
Caring for employees'
ψυχική
mental
υγεία
well-being is not only
και το
a
θέμα
responsibility,
της
a moral responsibility for both governments and employers, but also a conscious choice. The Ministry of Labour and Social Affairs is committed to improving workplace health and safety and ensuring healthy working conditions. Initiatives like the digital labor card, the protection of employees from workplace violence and harassment, regular inspections to uphold labor rights and enforce the law, the establishment of a framework for remote work, the extension of parental leave, all of these factors help reduce work-related stress and promote a sense of fairness and security. Equally important alongside these institutional measures is the cultivation of a new mindset, a new philosophy, I would say, that encourages open dialogue on mental health issues and works to destigmatize them. In this context, I would like to extend my warmest congratulations to the organizers and participants of the World Health Day celebrations at the European Parliament Liaison Office in Athens, held under the theme Mental Health in the Workplace, for emphasizing the importance of mental health and well-being in the workplace, as well as the need to address these issues openly. I wish you great success in your discussions. Thank you very much.
Well, we'd like to thank the Minister for this recording. And now I have the great pleasure of introducing Professor Nikos Papayioannou, who, in addition to being the Secretary General of Higher Education of the Ministry of Education, is also the ex-dean of the University of Thessaloniki. But in addition to this, he's a veterinarian. And this touches on me in some way because my uncle, the brother of my father, was also the dean in the the Aristotelian University of Thessaloniki, and he was also a veterinarian, which is
many years ago.
Many years ago. And this coincidence is really touching for me. Professor Papayioannou.
Thank you. Good afternoon, everybody. Honorable Minister of Mrs. Kerameos, Minister of Labor and Social Security, Honorable Deputy Minister of Health, Mr. Bartzopoulos. You know that he is a well-known psychiatrist, especially in the North Greece and in Thessaloniki. Esteemed guests, allow me to give my address, to give my regards in Greek language, because I strongly believe that for this, instead of scientific speeches, informal speeches, I believe that we can use our language. So, αξιότιμε κύριε Πρόεδρε της Ευρωπαϊκής Εταιρείας, ομότιμων καθηγητών, κύριε Χριστοδούλου, με ιδιαίτερη χαρά χαιρετίζω την έναρξη αυτής της ημερίδας που διοργανώνεται με αφορμή τον εορτασμό της Παγκόσμιας ημέρας ψυχικής υγείας, εκπροσωπώντας τον Υπουργό Παιδείας, Θρησκευμάτων και Αθλητισμού, τον κύριο Κυριάκο Πιερακάκη. Σκοπός της είναι να προωθήσει ανοιχτές συζητήσεις σχετικά με τις ψυχικές ασθένειες. Πραγματικά θα ήθελα να σας συγχαρώ για την πρωτοβουλία αυτή. Η ψυχική υγεία και ευεξία γίνονται πλέον παγκόσμια προτεραιότητα για όλους. Άλλωστε όλοι γνωρίζουμε το τι συμβαίνει τον τελευταίο καιρό, ιδιαίτερα στην πατρίδα μας, από εκδηλώσεις που εμπεριέχουν προβλήματα ψυχικής υγείας. Αποτελεί, νομίζω, καθολικό ανθρώπινο δικαίωμα η προστασία της, που περιλαμβάνει την αποφυγή κινδύνων, το δικαίωμα σε διαθέσιμη, προσβάσιμη, αποδεκτή και καλής ποιότητας φροντίδα και το δικαίωμα στην ελευθερία, την ανεξαρτησία και την ένταξη στην κοινότητα. Οι ψυχικά ασθενείς δεν είναι αόρατοι. Η 10η Οκτωβρίου, η Παγκόσμια ημέρα ψυχικής υγείας, τονίζει την σημασία των δράσεων που απαιτούνται για να προφυλάξουμε και να βοηθήσουμε τους ανθρώπους που πάσχουν. Από την άλλη μεριά, αξίζει και πρέπει να τονιστεί ότι ένα υγιές εργασιακό περιβάλλον και μια αξιοπρεπής εργασία αποτελούν προστατευτικό παράγοντα. Παρέχουν μέσα διαβίωσης, ευκαιρία για θετικές σχέσεις και ένταξη στην κοινότητα, συμβάλλουν στην προσωπική αίσθηση επιτυχίας και στην αυτοεκτίμηση, μειώνοντας έτσι το εργασιακό άγχος. Καθήκον μας είναι να προάγουμε την ευεξία στον χώρο της εργασίας, ώστε να συνδράμουμε αφενός στην αύξηση της παραγωγικότητας της κοινωνίας και αφετέρου στη διαβίου μάθηση και αυτοπραγμάτωση των πολιτών. Οι δράσεις λοιπόν για την ψυχική υγεία και ευημερία αναπτύσσονται συνεχώς, συμπεριλαμβάνοντας τους σχετικούς φορείς χάραξης πολιτικής, τους φορείς υγείας, εκπαίδευσης, κοινωνικούς εταίρους, καθώς επίσης και ανθρωπιστικές οργανώσεις. Κάθε είδους διάκριση πρέπει να εξαλειφθεί, αλλά και παράλληλα να αντιμετωπιστούν τα βαθύτερα αίτια που σχετίζονται με αυτή, οικοδομώντας κοινωνίες πιο συμπονετικές και ανθεκτικές. Είναι πολύ ενθαρρυντικό το γεγονός ότι η ημερίδα εξετάζει πολύ πιο εξειδικευμένα θέματα, όπως η αντιμετώπιση της επαγγελματικής εξουθένωσης για παραγωγή ψυχικής υγείας, η πολλαπλή ρόλη των γυναικών ως ιατρών, αλλά και ως επαγγελματιών υγείας. Για τον λόγο αυτό, με αφορμή τον εορτασμό της Παγκόσμιας ημέρας ψυχικής υγείας, αλλά και κάθε μέρα, ας αναλογιστούμε το καθήκον όλων μας να υποστηρίζουμε την ψυχική υγεία ως καθολικό ανθρώπινο δικαίωμα για να οικοδομήσουμε μαζί έναν κόσμο πιο υγιή, όπου όλοι μπορούν να ζουν με ευημερία. Εύχομαι κάθε επιτυχία στις εργασίες της ημερίδας και I hope that the next year, the next celebration, we will have the same success like today. Thank you so much.
Thank you, Professor Papaioannou, for this speech, half in English, half in Greek. And now we proceed with a video of Zoe Rapti, who is the Deputy Minister of the Ministry of Development, in charge of research, which, as I said, is very important. Instead of guesswork, we should all try to do research and have objective evidence of what we're saying. Excuse us for some delay. Here comes Zoe.
Αγαπητέ καθηγητά κύριε Χριστοδούλου, αξιότιμοι και αξιότιμες καθηγήτριες και καθηγητές, φίλες και φίλοι, σας ευχαριστώ θερμά για την πρόσκληση να συμμετάσχω στην πολύ ενδιαφέρουσα εκδήλωση της Εταιρείας Προληπτικής Ψυχιατρικής με αφορμή την Παγκόσμια ημέρα ψυχικής υγείας. Και βεβαίως θα ήθελα να συγχαρώ τον πρόεδρο, τον κύριο Γιώργο Χριστοδούλου, για τη σημαντική προσφορά του όλα αυτά τα χρόνια στην Εταιρεία Προληπτικής Ψυχιατρικής, αλλά και βεβαίως όλους τους αξιόλογους επιστήμονες και ομιλητές, αλλά και τους εκπροσώπους των σημαντικών φορέων ψυχικής υγείας που συμμετέχουν σήμερα και με τους οποίους πολλούς εξ αυτών είχα τη χαρά να συνεργαστώ ως Υφυπουργός Υγείας τα προηγούμενα χρόνια. Φίλες και φίλοι, η φετινή θεματική της Παγκόσμιας ημέρας για την ψυχική υγεία, ώρα να δώσουμε προτεραιότητα στην ψυχική υγεία στο χώρο εργασίας, μας υπενθυμίζει φυσικά πόσο σημαντικό είναι να δούμε την ψυχική υγεία ως ένα βασικό εργαλείο των εργασιακών μας πολιτικών. Γιατί ξέρουμε όλοι ότι σύμφωνα με τον Παγκόσμιο Οργανισμό Υγείας, 1 στους 8 ανθρώπους παγκοσμίως ζει με κάποια μορφή ψυχικής διαταραχής, ενώ εξ αυτών το 15% είναι εργαζόμενοι, αλλά όπως επίσης γνωρίζουμε ότι και το άγχος και η κατάθλιψη κοστίζουν πάνω από $1 τρισεκατομμύριο ετησίως στην παγκόσμια οικονομία. Άρα έχουμε και στατιστικά και για την Ελλάδα που το 25% των εργαζομένων αναφέρουν υψηλά επίπεδα άγχους, κυρίως λόγω όλων των αυξημένων εργασιακών τους απαιτήσεων. Τώρα, από το δικό μου το καινούριο χαρτοφυλάκιο για την έρευνα και την καινοτομία, το οποίο υπηρετώ σήμερα, θέλω να υπογραμμίσω ότι ακριβώς η τεχνολογία μπορεί να διαδραματίσει ένα καθοριστικό ρόλο στη βελτίωση της ψυχικής υγείας των εργαζομένων και προσφέρεται μια σειρά από εφαρμογές που μπορούν να ενισχύσουν αυτό που λέμε ψυχική ευεξία. Είναι γεγονός βέβαια ότι η τεχνολογική πρόοδος φέρνει νέες προκλήσεις, όπως είναι το άγχος της προσαρμογής σε ψηφιακά εργαλεία, αλλά και η ουσιαστικά αυξημένη πίεση για παραγωγικότητα. Αλλά είναι σημαντικό να υπογραμμίσουμε ότι στο Υπουργείο Ανάπτυξης επενδύουμε ακριβώς σε καινοτόμα προγράμματα που συνδυάζουν την τεχνολογία με την ψυχική υγεία. Και ενδεικτικά θα αναφέρω το πρόγραμμα Pythia, που στοχεύει στη βελτίωση των υπηρεσιών ψυχικής υγείας μέσω ψηφιακών εργαλείων, καινοτόμων βιοδικτών αλλά και εξατομικευμένης φροντίδας. Και επίσης είναι σημαντικό να τονίσω ότι όλοι και στο Υπουργείο Ανάπτυξης εργαζόμαστε σκληρά προκειμένου να διασφαλίσουμε ότι οι εργαζόμενοι μπορούν να απολαμβάνουν έναν υγιή εργασιακό χώρο όπου η ψυχική ευεξία βρίσκεται ακριβώς στο επίκεντρο. Χρειάζεται, όλοι το ξέρουμε, μια συλλογική προσπάθεια και για να δημιουργήσουμε πάντα ένα υποστηρικτικό εργασιακό περιβάλλον, γιατί όλοι επίσης ξέρουμε ότι η ψυχική υγεία δεν είναι ατομική υπόθεση, αλλά συλλογική ευθύνη. Θέλω λοιπόν να σας ευχαριστήσω για την πρόσκληση, να απευθύνω αυτόν τον διαδικτυακό χαιρετισμό και βεβαίως να ευχηθώ με την καρδιά μου καλή επιτυχία στις εργασίες της σημερινής σας εκδήλωσης.
Αξιότιμε Πρόεδρε της Ευρωπαϊκής Εταιρείας Ομοτήμων Καθηγητών, κύριε Γεώργια Χριστοδούλου, αξιότιμε Γενική Γραμματέα της Εταιρείας Προληπτικής Ψυχιατρικής, κύριε Νίκο Χριστοδούλου, αξιότιμη Πρόεδρε του Δικτύου Φροντιστών Επιώνη, κύριε Σπυρίδωνα Ναζορμπά, αγαπητοί σύνεδροι, εκλεκτοί συνάδελφοι, αγαπητοί φίλοι. Με ιδιαίτερη χαρά απευθύνω το χαιρετισμό μου στην ημερίδα αυτή, η οποία πραγματοποιείται με αφορμή την Παγκόσμια ημέρα ψυχικής υγείας. Η πρωτοβουλία αυτή αποτελεί μια εξαιρετική ευκαιρία να αναδείξουμε τη σημασία της ψυχικής υγείας στον χώρο της εργασίας, ειδικά σε μια εποχή αυξημένων απαιτήσεων και προκλήσεων. Ως πρόεδρος του Ιατρικού Συλλόγου Αθηνών, έχω θέσει ως προτεραιότητα τη βελτίωση της υγείας των εργαζομένων και την προώθηση προγραμμάτων που στοχεύουν στην πρόληψη και την αντιμετώπιση του επαγγελματικού στρες. Μέσα από δράσεις, ενημέρωσης, συνεργασίες με επιστημονικούς φορείς και παρεμβάσεις υποστήριξης, συμβάλλουμε στη διαμόρφωση ενός υποστηρικτικού περιβάλλοντος που προάγει την ψυχική ανθεκτικότητα και την προστασία των εργαζομένων. Η Παγκόσμια ημέρα ψυχικής υγείας μας υπενθυμίζει τη σημασία της συλλογικής δράσης και της ευαισθητοποίησης, ώστε να διαμορφώσουμε συνθήκες εργασίας που ευνοούν τη συνολική ευεξία. Είναι καθήκον μας να ενθαρρύνουμε τη συνεργασία όλων των κοινωνικών εταίρων, ώστε να προωθήσουμε την ψυχική υγεία και να βελτιώσουμε την ποιότητα ζωής σε όλους τους επαγγελματικούς χώρους. Εύχομαι καλή επιτυχία στις εργασίες της ημερίδας και προσβλέπω στα συμπεράσματά σας, τα οποία θα αποτελέσουν πολύτιμη βάση για τη διαμόρφωση πολιτικών δράσεων που θα ενισχύσουν την ψυχική υγεία στους χώρους εργασίας.
Starting from Juan Mesic. Juan Mesic is a very important figure in international psychiatry. He is professor of psychiatry at Mount Sinai School of Medicine of New York University and has been the president of the World Psychiatric Association. So it is with great pleasure that and anticipation that we're going to hear what he has to say about this issue, which is crucial, the issue of mental health in the workplace. Professor Mesic is half Peruvian and half American. And in addition to his various titles, he is also president of the International Society of Person-Centered Medicine. A campaign which has application not only in psychiatry, but also in various branches of medicine, because it incorporates collaboration of various branches. It is, as we say, interdisciplinary.
Mr. Message is not connected.
Have you ever visited Peru, where Professor Magis comes from? We have visited it twice, and we're impressed by the fact that because of the height, we had some difficulty in breathing.
Can
Let's
we,
move to the next speaker, and then Juan will have the chance to connect in the meanwhile.
Gabriel, probably?
Gabriel Invizarro.
Yes.
Gabriel, can you unmute?
Yes, I can hear you now. Okay.
You can share your screen.
Okay. Okay, can you see my screen? Can you hear me? Can you hear me? Hello? Can you hear me?
You can start, yes.
Okay, okay, thank you very much. So thank you very much for inviting me to this special event. I'm very grateful to be here with you. My name is Gabriel Invizarro. I'm the current Secretary General for the World Federation for Mental Health. Okay, so first of all, I want to say thank you to the organizers and thank you to my good friend and mentor, Joe Christodoulou, who I've known for many years, who has been very supportive to the work we've been doing in WFMH, and who is also very active in the field. I intend to share within the next 10 minutes a few things. I want to share with you how this year's World Mental Health theme was chosen, the importance of this theme, and to talk about life-work balance and also make some practical suggestions. The theme was chosen by WFMH through a global vote that everybody contributed to, and the theme with the highest vote was the thing that was chosen this year. So I want to thank the president of WFMH and all the board members and everybody who helped in making this a success. I also want to share with you the message we received, today from the UN Secretary General, His Excellency Antonio Guterres, who reminded us that work was very important, that COVID-19 has changed the landscape, and that really we have to do more to ensure that employment pays and people who are in workplace enjoy what they are doing. Despite the current crisis globally, it's shared the time to write this. So this is available for all of you to read, and it emphasizes that over 60% of over 15 are in employment. When this year's thing was chosen, that it's time to prioritize mental health in the workplace, I had to do some research on behalf of WFMH. And what I found out was that as far back as 1948, the WFMH has always been involved and worked on employment and labor as a priority. So really, this is not new. But yet, since 1948 that we've been doing this, there's a lot still to be done. So what can we do? So I will be coming with some practical suggestions. What do we know about employment? We know that work is very important for well-being. We also know that well-being is also important for work. So really, it's a two-way road, that the two actually are interconnected. So if you have poor well-being, you have poor productivity. And if you have good well-being, you have good productivity. So really, what we should be thinking about and looking for is how do we ensure that people in work enjoy it, and also that people can bring good things into work to make it more productive. So really, I will say something just before I end up, So one of the things we also know that majority of our adult life is spent in working. So it's good, either paid or unpaid, as Professor Christodoulou said earlier on. So we have to find a way to value these contributions. And we know that work pattern change over time. So when you are younger, something different. When we get older, it may be different. But also, technology becomes very important in things we do. One of the key things I want to stress today is that the workplace is not just the office, as George said earlier on. The workplace can also be our home. So we need to begin to think about that in a better way. So how do I need to conceptualize the well-being and workplace? So I've been thinking about this for some time, and I've been looking at social consequences of what was doing the right thing. So I kind of put it together in this triangle, which I'm going to spend a few minutes to talk about, and then hopefully I will then speed up. So really, for employment and well-being to work together, we have to have appropriate legal framework that supports it. So therefore, you need good HR, good legislations. I was glad to hear what the European Parliament was doing. You have to train, so you have to train people in what they do. So, and we have to then understand that work, as I said, comes in two fashions. One, work-related activities, and what I call non-work-related activities. We have to have a balance between the two. The two must mix together. If you are at home not happy, you cannot contribute well at work. And if you're at work, you are not happy, you cannot be good at home. So really, we have to think about how these two systems work. One of the things that can help us is about self-care. So we need to look at self-care as part of the things we do at work and at home. And what we mean by self-care, we mean looking after oneself, psychologically, socially, going for work, exercise, spending time with family, but importantly, to be altruistic. And that's really one of the things that literature tells us, that volunteering, altruistic activities does help. We have to then look at the type of job we do. The more complex the work it is, the more demanding it can be. So what kind of support do we give to people in more demanding situations? Individuals have to be empowered to do what's called demand management. So you have to be able to manage what you do at home and manage what you do at work to put it together. But more importantly, we have to talk about what's called equal value. There's too much emphasis on the highest paid worker in the system, or the most, the chief executive. But really what we need is not that. It's even the person that cleans the toilet is just as important. So equal value. So when we give equal value, people feel better in what they do, and they do better in their work. So we have to begin to think about rethinking the way we think of work. There is an interface of many things. So it's not just going to the office. How do you get to the office? When you get to the office, what is office providing for you? So this is a complex mechanism, but we can work on it. So I will encourage you, first of all, to take this triangle away and see where you fit in the system, also in your workplace. Then, if you know that about work, what do we do next? We have to then begin to think about the resources that we use. So what we call a personal resource allocation framework. When you give somebody a job, what does it mean? When are you supposed to do it? Are you supposed to do it in the middle of the night, daytime, or what? And also, how do you know you are successful? So individual outcomes must be clear, so that people know they are successful. And therefore, you don't have the chronic stress that George spoke about earlier on. And you, as an individual, you have to think about, do I have the resources to do this work? Have I got the time, the energy, and the finances for it? But we have to then think about external factors, so there may be external demands that are put on the system. So for people who manage workers, you need to think about it. Have I provided the appropriate framework really for the worker? For the worker, have I got the appropriate framework to do this work? And also the system putting us on too much undue pressure. So really, this is the kind of thing we need to begin to think about if we're going to be successful in managing employment situations. Where we work matters, and our home also matters. So really, more people are going to be working from home, either as a consequence of COVID-19 or because of other reasons. And we have to play special role for women and women role in work. So really, women not only work, they also are mothers, sisters, aunties, and wives. So really, we have to find a special role and make sure we give them the respect that they need. I looked at one of a lecture given by President Hollande some time ago, and he talked about, since 1948, what has happened. And now we are facing the same situation. Where at the time, there were wars and other issues, but now we have new challenges. Wars, pandemics, inequality, stigma, man-made disaster, technological changes. So we have to think about well-being and work within this new context, this new framework. So people who may be doctors in their countries now move to a new place, they cannot do the role. How can they be happy? Can we retrain people? Or do we need, or what else do we need? So really, what we need to think about, as I said, is the triangle, first of all, about the needs of well-being in the employment place and the framework for, enhancement of this. We have to find a way to bring all together so that people can feel proud to go to work, or if you cannot work, maybe you should be at home. It's not the issue at that time. It's about you are not capable at the time. I would suggest that all employers should have a well-being worker. Psychological first aid should be promoted so that we can recognize people when they are in distress both at home, in employment places. And the good thing about psychological first aid is free from the WHO. So really, how do we make sure everybody is given this tool to be able to, support each other? So really, I'm gonna try to end up by saying we need a new agenda, a global public health action for us to begin to see how to merge work and home together in a better way so that we can value what each of us are contributing, and in a different way, different from what has been in the past. So thank you very much for allowing me to speak to you today. I look forward to seeing the rest of this deliberation. Once more, I am very grateful and thank you.
Thank you, Gabriel. Thank you very much for your talk. And now it's my pleasure to introduce Professor George Crusos, who is an academician in the Academy of Athens, professor of pediatrics at the University of Athens, and well known for his research in stress. So we psychiatrists are delighted that George is so much involved in an area in which psychiatry has something to say.
A lot.
In the next 10 minutes, I'll say a few words about work stress. And especially, I will use the example of healthcare personnel where there is a lot of data. First, I'll give the definition of stress, which is a state of threatened or perceived as threatened homeostasis. I say perceived because humans have the ability to understand when they are stressed. The best definition of stress was given by Epicurus in ancient Greece. He said, eustathia or eustasis is the balanced state of the flesh and the soul. So he really captures the concept. Now, there are many human stressors, and I'll just mention the ones that are particularly important for the work environment for various reasons. These are the ones with the blue letters: excessive nutrition, deficient exercise, obesity, work stress. Usually the effort reward is imbalanced. Most people think that the effort they put in a job does not translate into appropriate reward. So there is a quotient there, the ERI, effort reward imbalance, and there is a very good correlation between this marker and cortisol levels in the working people. Of course, unemployment is a terrible stress, primarily because when somebody is unemployed, has a problem with his dignity. He feels that he's not participating in the human society. Also, work stress can be associated with loss of control, with a feeling of social restriction, with, especially in the healthcare personnel, with pathologic empathy rather than principal compassion. And finally, with sleep deficiency and uncoupling of the clock, working days and nights, is a so-called work-related jet lag. Is quite harmful. Now, we all have the so-called stress system, which is activated when we're stressed. This is an acute system. It's meant to be activated to fight, flight, or get a freeze reaction when we're stressed. It doesn't last very much. Fight corresponds to aggression and anger, flight to fear and anxiety, and freeze to paralysis. Unfortunately, nowadays, most stress in Western societies is chronic psychosocioeconomic. In other words, we have a chronically activated fight, flight, and freeze reaction, meaning we have chronic smoldering, waxing and waning state of fear, anger, and paralysis.
I'll be doing
Now, whenever there is chronic psychosocioeconomic stress, I put economic there as well, there is activation of the stress system and the inflammatory reaction. Why? Because the stress system also activates the immune system when it's activated. And what happens then, as time goes by, we develop the so-called chronic stress and inflammation syndrome. This is a syndrome that has psychological and physical manifestations. We have overweight, obesity, dysphoria, the so-called medically unexplained symptoms, or MUS, autoimmunity, allergy, hypochondriasis, osteosarcopenia, etc. You can put all this together under the term chronic non-communicable diseases. And of course, we have associated sleep disorders, accelerated aging, because that's what the stress hormones do. We have increased cancer risk and even increased risk for some infections, not for all. And we saw that with the COVID pandemic. Finally, we should always get into account infections, even if they are subclinical, and the large number of environmental toxins that we have released in the environment, and we're exposed to them constantly, and it's getting worse, not better. Now, there is a lot of information about stress in physicians and nurses and other healthcare personnel during the COVID-19 disease. Healthcare workers during this pandemic described the hospital environment due to the coronavirus disease as a war zone. They described a chaotic, traumatized environment surrounded by death of individuals unable to say their goodbyes with family and family members, unable to grieve in their culturally acceptable manner. There are two prevailing professional-related syndromes. The burnout syndrome, which is general, you don't have to have COVID, and the post-traumatic stress disorder, which was quite common during the COVID pandemic, but not as common during regular states. So physicians really suffered stress during the pandemic. But generally, we have a lot of data collected for the US National Academy of Sciences. There was a meeting that I attended in 2019, and they're very good epidemiologically supported information, which I'll give you. Up to 50% of health personnel suffer from burnout symptoms. And these are people that work in emergency medicine, primarily, family medicine, general internal medicine, and neurology. Now, important factors were country and health system. For example, data from US, Brazil, India, and Poland show that physicians and nurses don't do well. They die younger. I'll give you the specifics. In the UK, it appears that physicians have a normal life expectancy. Comparisons within the same SES, US physicians had decreased life expectancy for surgeons and primarily anesthesiologists. So it's not a very good specialty. Now, the key burnout features were emotional exhaustion, dysphoria, depersonalization, distance from the situation, cynicism, and low sense of personal accomplishment. And there is a burnout inventory, the Maslow's burnout inventory, where you can really grade the degree of burnout. Interestingly, burnout is there in the International Classification of Diseases and Related Health Problems in the 11th revision, which was in 2019, but is not there in the DSM-5. Psychiatry does not consider it a real psychiatric disorder. They think it's a reactive disorder due to environmental conditions. Now, as far as post-traumatic stress disorder is concerned, the key symptoms are re-experiencing the traumatic event, avoidance, negative moods and cognitions, arousal and hypervigilance, and sleep disorder, insomnia, primarily, and aggressive, reckless, and self-destructive behaviors. Of course, this is a serious syndrome that's described in the DSM-5. Now, what are the personal consequences from studies that have been done in US physicians, not during the COVID, generally? There is increased alcohol abuse and dependence. We did a study here, and we found that the surgeons, Greek surgeons, also abuse alcohol. Major depression, suicidal ideation, and suicidal ideation and suicide is up in males, but mostly in females. And the actual data, if you put them all together, men physicians live 5 years less than other educated persons like engineers or lawyers, while women live 8 years less than the corresponding women in other professions. So there is a toll that is exacted upon physicians. Now, what are the work-related drivers? First of all, longer work hours. Second, night and weekend calls. Third, work-related hours at home. The people take work at home. Work-home conflict with their family and their wives or their husbands. Moral distress because of the situation at the hospitals. And leadership behavior. That actually was mentioned. Poor leadership was a major driver of unhappiness in healthcare personnel. Now, the work-related modifiers are specialty, I already mentioned that. Whether somebody's in private practice, it's worse in private practice. Whether there is incentive pay, so it helps if you pay better. What's the career stage? Most people who get the syndrome, and many of them abandon the profession, is at mid-career. Whether there is a career fit, some people change specialty, and whether they have clerical burden, especially computer entries. Physicians complain a lot about having to deal with a computer every day. Now, there's been the Action Collaborative on Clinician Wellbeing and Resilience. That's the so-called quadruple aim. This is related to patient satisfaction, reduce bad health outcomes in patients, the reduced increased costs, and good care of the provider, in other words, the physician or the nurse. In fact, there is a fifth factor, that's profitability, that plays a tremendous role on how hospitals and medical schools respond to the problems. Now, what are the principles of highly performing teams? They have shared goals, clear roles, they have mutual trust, so people feel safe in their team, effective communication between the members of the team, and measurable processes and outcomes. Now, what are factors improving clinician well-being and resilience? External factors like improve the working environment, what I mentioned already. An individual, like improve self-stress management skills. And there is a lot of effort into improving the stress management skills of physicians and nurses. The clinician support includes better leadership, a wellness department or team in the hospital or the medical school, several health initiatives within the organization, community support. We have the so-called swords rounds and balloon groups, etc., mostly run by psychiatrists. We have the Mindstrong program, which entails CBT, cognitive behavioral therapy, mindfulness, etc. And finally, we hope that people start with a healthy baseline homeostasis that may be disturbed by acute stressors, but goes back to where it should be immediately after the stressor. That's the acute stress, and usually there's a good outcome, no damage to the physician. On the other hand, there is a state of chronic stress, deteriorated homeostasis with suppressed mood and problems with the syndrome that I mentioned earlier. I call it kakostasis instead of homeostasis or eustasis. But also there is a good condition that's protected, improved homeostasis or hyperstasis. And what does that mean? It means we have improved resilience, that is small disturbance when they're stressed, and quick recovery into our basal healthy state. I should mention that people who had a harsh life early in their childhood and pubertal years, adolescent years, those people are more sensitive to stress later on in life. So we should take that into account whenever we choose a profession. And what can we do about stress? Well, of course, there are some basal social prerequisites. However, we should take care of nutrition, exercise, sleep, and circadian regularity. Stress management, of course. Then also provide to people an environment that's we can call eustress, good stress. That means stress that results in pleasure rather than in unhappiness. Human beings have the so-called affectance property, which means they have an inner tendency to control their environments, to learn things, and so forth. And the more of that you do successfully within the day, the better you feel. That's eustress. Then experiencing flow, pathos with something, art, your family, reading, whatever. Various methods of noopedia, mindfulness, and so forth. And the most important of all, meaning in life. And I think people who work in the health field should be able to find meaning in life in taking care of other people. That's the ultimate altruism. The social prerequisites are feeling relatively safe and secure, integrated in the social environment, feel competent, be authentic, have some autonomy, and have a good surrounding environment. So you can do a lot of things about stress, and that's good for everybody, not just for physicians. So lifestyle factors, life values and goals, life meaning lifts us up. The opposite happens when we have chronic stress and chronic disease. I put this slide because I want everybody to know that everything is reversible. And the earlier you start, the better it is. Stress starts early in life, even in utero, when we are in our mother's womb, and it's there throughout life. And the earlier we start controlling stress, the better it is. And if you need any information, that's my site and the institute where I work. Thank you very much.
Thank you very much, Professor Buscher, for this talk, which has produced quite a lot of disasters here. You can see that. I think this information is very useful to everybody, and falls within the area of health promotion and mental health. So thank you very much. So next speaker, Spiros, I think is Danuta Wasserman, who will
We
speak.
have also Professor Mesic connected.
You have Professor message. That's fine. Okay. Let's hear
So
one.
we can give the floor to
To Lydia. Lydia.
Hello.
Lydia.
Hello. Oh,
Hello, Lydia.
hello. But I think Professor messages before.
yes.
You were named as
Oh. We don't hear you.
Well, thank you, Lydia, for being so kind to me. I'm sorry that I not connecting at the right time, and I misjudged the difference in time between New York and Athens. And I have the pleasure to once again participate in this important celebration of the Mental Health Day, which is becoming a tradition from Athens, as it happens also from other parts of the world. But we have our distinguished colleagues there who keep up the high ideas that we all health professionals have to contribute to better well-being and mental health across the world. I am wondering, Spiros, if you could project my slides.
Possible that you share?
Spiros, could you share my slides? I could try to do it myself, but sometimes my computer misbehaves. While this is mounted, I'd like to say that what I'm going to share is examination of what seems to be maybe the most prominent goal of health actions, namely general well-being, and then what the contribution to that may be of mental health actions, not only in general, but particularly in the workplace. Right. So to do this, I will share a few slides, 5 basic slides presenting studies that I reviewed with the help of Mr. Google to identify a couple of national studies on the relationship between mental health to well-being in the workplace. And then a couple of slides from the World Health Organization. And finally, some conclusions. The first one comes from India, from the Hindustan Liver House, titled Mental Well-being at the Workplace. So I try to keep in focus the relationship of mental health to well-being in the environment that is the matter for this year's World Mental Health Day. So it is being increasingly recognized that mental health on employees is a crucial determinant in the overall health and the poor mental health, and the stressors of the workplace can be a contributory factor to a range of physical illnesses like hypertension, diabetes, and cardiovascular conditions. Also, data from different countries around the world indicate that mental health problems are a cause of a number of employees dropping out of work. Mental health problems have an impact on employers directly through increased absenteeism, negative impact on productivity, and an increase in cost to deal with the issue. and also could be considered that work-related stress is a major cause of occupational ill health broadly, including impact on productivity and human error. And finally, that the development and implementation of a workplace mental health policy and programs will benefit the health of employees, increase the productivity of the organization, and contribute to the well-being of the community at large. These are my selection of key findings from this national study from India. The next one, please. The next one comes from the United States, specifically from a study from the US Surgeon General, just a top public health official in this country. The title Framework for Workplace Mental Health and Well-Being. It puts under our consideration that sustainable change must be driven by committed leaders in continuous collaboration with valued workers who power each workplace. The most important asset seems to be in any organization is people. By choosing to center their voices, putting the people at the center, we can ensure that everyone has a platform to thrive. And they illustrate their findings by identifying 5 essentials for workplace mental health and well-being, which are illustrated here graphically, in which, as we can see, they have considerations which have to do with protection from harm, connection and community relations, work-life harmony, not yet. I will tell you when not. Yeah, please. Then the mattering of work specifically, and opportunities for growth. So at the center of all of these essentials is what they call the worker voice and equity. Okay, now let's move to the 2 international slides, intergovernmental slides coming from WHO. I hope that Lydia may agree to this too. And the next, please. This is the one before. The one before, right. This one. This is a study and recommendations under the title of Workplace Wellbeing Initiative 2024. The primary cause of poor workplace well-being is work itself. Second, that workplaces must address employee social connection and loneliness. So clearly pointing out how important for the well-being in the workplace is a number of psychosocial factors, namely mental health considerations. So workplaces must address employee social connection and loneliness. It's becoming a major public health, especially noted since the pandemic. The virtual communication skills are so common, including how we're communicating at this moment, are imperative for the future of work. And then poor employee well-being has a serious impact on business performance. Women face a unique set of challenges when it comes to well-being at work, importance of considering then key demographic factors. And there is a gap between management and employees on workplace well-being. So still there is room for improvement here. And finally, that peer support makes a positive difference to employee well-being. And then finally, the next slide, please, also from WHO. The next one, please. Indicates that World Health Organization study in the technical consultation meeting of the 25th of April of this year, titled Protecting Health and Care Workers, Mental Health and Well-being, in which they point out that the high level of stress, burnout, absence from work, and strikes affecting the health and care in the of the workforce as a symptom of the current state of health systems. A major factor that is emerging when we discuss problems of mental health or well-being is to consider the setting where this happens. There are normal reactions in the face of staff shortages, low pay, inadequate and unsafe working conditions, extraordinarily stressful environments, and a lack of needed workplace safeguards. All of them are important to consider. And finally, that our duty to care includes a global call of action to protect the mental health and well-being. Again, these two concepts distinctly pointed out, of health and care workers. Also interesting is the distinction and the inclusion of both the health and the general care system. So not only health care, but health and care as two complementary activities, two complementary set of actions. And finally, some conclusions which not only come from an analysis of the two national studies and the two international perspectives I just reviewed, but also from some studies that we have done in collaboration with our colleagues, particularly of the World Psychiatric Association. I'm delighted that Norman Sartorius is joining us. So inspiring to all of us. And with him and Council of former presidents of the World Psychiatric Association, we have been reviewing some of these issues in recent World Congresses of Psychiatry. So from putting together all of this, I'd like to formulate the following conclusions concerning the overall theme of what is the contribution of mental health to general well-being in the workplace. It seems from all of those considerations and analysis that the fundamental goal of health and social actions is emerging to be the general well-being of all across the life cycle. That even at the governance level, as indicated by recent perspectives from New Zealand, where they have pointed out that the basic purpose of the country, as expressed in the national budget, should be the promotion of well-being of all its citizens. So, for the achievement of such desirable general well-being, mental health is not just one component among many, as listed in the definition of health from the WHO, inscribed in its constitution in 1948, but the most critical one. This is what is emerging as a very interesting, in a way, discovery. And this seems to be true both in general, again, as reflected in the definition of health of WHO 1948, as well as in the proclamation of the Sustainable Development Goals of the United Nations in 2015, but also in the workplace specifically. So by paying attention to the workplace, we are paying attention to an important area for the fulfillment and lives of human beings, but also keeping in mind the general perspectives to guide our work as mental health professionals to keep in mind that what we do to promote mental health contributes in a critical and fundamental way to the fundamental action of health actions and health professionals, which is the promotion of well-being for all. Those are my conclusions, and I would be delighted to have further discussion if there was any interest at the end of this panel. Thank you.
Thank you, Juan. This was an exceptional talk, as always. Thank you very much for being with us.
My pleasure, George.
So we continue with Danuta Wasserman, who is the president of the World Psychiatric Association, professor of psychiatry and suicidology in Karolinska Institutet in Sweden. A great pleasure to have you.
Έχει ένταση.
Professors, society.
Κλείστο, Γιάννη, τελείωσε.
This year's theme for the World Mental Health Day is priority of mental health in the workplace. And I would like to thank you especially Professor George Christodoulou, who is organizer of this event on behalf of European Associations of Professors Emeriti, Society of Preventive Psychiatry, and the Epion Greek Careers Network. I would like to say a few words about the World Psychiatric Association first. The World Psychiatric Association comprises 147 psychiatric societies from 123 countries, with 70 scientific sections and with more than 250,000 psychiatrists. World Health Organization mission and activities to promote mental health and to encourage the highest standards of clinical practice and ethical behavior in psychiatry. I introduced during my presidency 23 to 26 so-called EDIT principles, and in the context of the theme for this year Mental Health Day, we can say that E stands for equal right to work for all genders, ages, and ethnicities. D stands for developmental stages, each of which has unique needs and rights with regard to its place in or outside the workforce. Of course, for children and adolescents, there should be working schools, but not paid or unpaid physical or other work. And for elderly people, inclusion in the work, which is very important for mental health of all elderly people, but also of people of all ages, and also very good for economical conditions in our societies. So in many societies now, it is encouraged that people after retirement age can be employed and work with knowledge, energy, and passion. I stands for inclusion of locally underrepresented groups in the workforce, especially in today's context of elderly persons. And T stands for transcultural aspects and differences. For example, in language, culture, religion, attitudes, and values in workplace. And we need to increase awareness about it. My action plan for WPA during the years 23-26 is based on 70 United Nations Sustainable Development Goals, from eradicating poverty, hunger on the globe, to good climate, good working conditions.
Okay.
Μην το κλείσω. Κλείσω τελείως.
Our life and provides financial support as well as a sense of meaning, fulfillment. However, for too many people, work and workplace actually undermine mental health and cause stress, anxiety, and other problems. Prioritizing mental health in the workplace is a vital component for a sustainable future, and the psychiatrist can play a large role in this effort. We need to increase awareness that the balance between the demands of work and the control over working processes has an impact on the workplace environment and the mental health of everyone working there. As psychiatrists, we should increase employers and employees' awareness of the imbalance between demands placed on the individual and on the group in the working place, and the resources available to the individual and group in the working place for dealing with those demands determines the quality of the workplace, determines the mental health of both employees and employers, and in turn, work-based productivity. And increasing of this awareness can be done by our profession. Thank you once more for inviting me to participate in your event. Thank you for organizing this event. And thank you that you will increase awareness that we as a profession can contribute to better mental health in working places, and by that to transform our world to a better place. Thank you once more.
Thank you, Danuta. We had some difficulties here with the technical part, but we could see your slides. Thank you very much for your contribution. And now we turn on to Lydia Lazeri, who is the WHO Regional Advisor for Mental Health in the area of Europe. So we look forward to whom I can see in the picture.
Hello? Hello?
Yes, yes.
Hey, hi, thank you. Good afternoon, and thank you very much, Professor Christodoulou, for consistently inviting me over the series of the webinars you organize every year on the occasion of the 10th of October, the World Mental Health Day, and you show consistent leadership into keeping high the profile of mental health in Greece, but also beyond. And for that, you have my sincere thanks. I'm going to share with you a bit of information about how WHO is approaching mental health at work, but also about some concrete actions that we at WHO Europe are undertaking to address this concern. I'm not sure if my slide is shown, so can I have a confirmation that the slides shows in the screen?
Yes, yes.
Thank you, thank you. So I'm afraid I have put the wrong, I'm sorry, just a second, I'm not sure. Yeah, this is the right, yes, this is the right. So why address mental health at work at all? First of all, because we have facts that work can protect or worsen mental health. Second, because 1 in 6 working age adults are estimated to have a mental health disorder. And then there is a global taboo about the real cost of workplace mental health that is estimated to go up to $1 trillion US, but it is hardly talked about. The precedence for actioning, for taking action on mental health at work is found in the WHO Comprehensive Mental Health Action Plan, also on the WHO Global Strategy on Health, Environment and Climate Change, and last but not least on the Convention of the International Labour Organization on Occupational Safety and Health of 1981, and the recommendations that have been updated ever since. The context of this work is that we have a lack of regulation for interventions related to mental health at work, and we have worsening working environments for many, not starting with COVID-19, but exacerbated and made brought to daylight by COVID-19. So the global public health community could no longer ignore the fact that the pandemic worsened the working environments for many in the society, including health and care workers. Now, there are 2 main documents that are there to be referred to. The first is the WHO Guidelines on Mental Health at Work, and the second is the policy brief jointly developed by the WHO and the International Labour Organization. I'm going very briefly over those because I would like to focus more on the European developments. But very briefly, there are three strategies identified. The first strategy to prevent, meaning to reshape work environments to minimize psychosocial risks and prevent workers that experiencing mental health conditions. The second strategy is to protect and promote, which means to strengthen awareness, skills, and opportunities for recognizing and acting early on mental health issues, to protect and promote the mental health of all workers. And we'll see that this is a collective responsibility, the strengthening of awareness. And the third strategy is to support those. It means support workers with mental health conditions to access, to continue working and thrive at work. Now, there are 7 cross-cutting actions that are proposed to operationalize those strategies that I mentioned. The first is to strengthen commitments to mental health at work, and that requires leadership. The second is to secure sufficient funds and resources to protect, promote, and support mental health at work, and that requires investment, such as, for instance, well-being clinics at the workplace. The third is to uphold people's right to fully and effectively participate in work, so that we all are entitled to the rights to work regardless of the status of our health or both physical and mental health. The fourth is integration, so integrating action to prevent, protect, and promote and support mental health at work across sectors. So that means that mental health at work is not only responsibility of the health sector, it's responsibility, of course, of employment sector, education sector, welfare sector, and so on. The fifth is participation. So to engage workers and people with lived experience in decision-making about mental health at work at all levels. So listen to the workers about how they would, what they would think about what could help their mental health and well-being at the workplace. Next is to strengthen the evidence based on the prevalence and impact of work-related risks and as well as effectiveness of interventions, because as we have seen, it has been mentioned that there is not a lot of evidence about those issues, and especially about the what is the cost-effective, what are the cost-effective interventions in this area. And last is compliance, so strengthening uptake of and compliance with laws, regulations, and recommendations. As I'm sure many of you would recognize and would have seen, many countries have very good laws and regulatory frameworks that are aiming at promoting and supporting mental health at workplace, but very often those laws are poorly implemented, or there is a lack of normative acts that regulate or support the implementation of the laws at the field level. Now, when it comes to, I'd like now to focus on healthcare as the workplace, no, because this has been also, I have listened with much attention the previous speakers, and it is very clearly a concern about the fact that the mental health of the healthcare workers is in jeopardy. It is a shared concern of many of us. And we see that, as I mentioned before, COVID-19 pandemic uncovered the burden that health and care workers were already subjected even before the pandemic, but it was probably a silent suffering, a silent burden. The pandemic uncovered it, and the world could no longer ignore the burden that was imposed on health and care workers. Just to mention, you see here, those are some publications that do aim at highlighting the concern, but also I'd like to share with you that even before the pandemic, we had seen, for instance, following the World Mental Health Atlas, between the two previous editions before the pandemic of the World Mental Health Atlas, the one published on 2014 and the one 4 years later, we have seen that the psychiatric nursing workforce lost 13%, 1/3 of the workforce. And that is an alarming figure. It happened already before the pandemic. Unfortunately, we don't have an understanding of why it's done, but it is very likely that overwhelming working conditions for the psychiatric workforce may have to do with, or to some extent may have to do with the decline in with the hemorrhage, let's say, of the psychiatric workforce in Europe. Then we have seen that mental illness and suicide among physicians is there to stay, and the Lancet acknowledged in 2021 that the mental health and well-being of physicians have been neglected for so long. Now, in terms of mental health and well-being of the health and care workforce, during the pandemic, the studies that were carried around this issue were considering non-representative samples. There were no follow-ups, and there were studies only by self-reporting. And also the pre-pandemic studies were scarce or inexistent. So we are swimming here in very unknown waters, and that's why we need to have more data here. We need to know more so that we can address the problem at hand better. And this is why WHO Europe now In frame of a contribution agreement between WHO Europe and the European Commission, we are conducting a survey on mental health of health and care workers. The aim is to describe the mental health problems and well-being indicators of healthcare workers, and also to analyze their association with socio-demographic and workplace-related factors. And you see here a screenshot about the questionnaire that is going to be launched in 10 days from now. The scope is towards the 27 EU member states plus Iceland and Norway. And you'll see here that the survey will be offered to be taken in all the languages of the 29 countries. So it's altogether, I think it's 26 different languages that those countries do use. That is made on purpose to, of course, to enhance uptake from the healthcare workers, and I'll talk in a minute. The sections those are the survey sections. So we start about like very basic data about location, yourself, but of course it will be anonymized. People will not be identified individually, but will need to have a bit of information on what kind of education level, for instance, people have, etc., etc. So those are the sectors. And then we'll continue with 2 short mental health questionnaires and 4 questions about alcohol use that has been discussed in the group that when we were developing the questionnaire, because obviously the evidence is there that health and care workers do have, so alcohol use is a problem to be investigated and addressed among health and care workers. So those are the questions that you see there. We have questions about well-being, and please notice that the demographic questions are taken from Eurostat surveys, while the mental health and well-being surveys are taken from surveys such as WHO5 or Copenhagen questionnaire, or and so on and so forth. Now we are trying to, so those surveys have been taken as examples for drawing indicators in the questions in terms of demographic indicators. And in terms of mental health problems, we have focused on PHQ-9, on GAD-7, on the CAGE questionnaire for alcohol use, on the WHO5 well-being index, and so on. The survey will be launched on the 22nd of October, so only less than 2 weeks from now. It will be open online 6 to 8 weeks. It's a population-based survey, and the way how we are administering it is through the European Associations of Doctors and Nurses that will in turn contact national associations and request them to approach their membership and try to have as high a response as possible along all the health and care work for doctors and nurses of the countries that I mentioned. We are not approaching particular specialists, and so we are not talking about psychiatrists versus GPs, for instance. We are aiming at all those who are working as doctors and nurses in their particular countries, regardless of whether they are public services or private services. We want to have as high a response as possible. And the survey link will be disseminated by the national associations. This is a huge exercise. It is more than 1 year in the making. But when this happens, it will serve as a baseline for repeating the survey over the years, and then we can notice what are the longitudinal trends on the mental health and of the health and care workforce. In addition, I'd like to also mention that today WHO launched a call for urgent action to strengthen the mental health of the health and care workforce. This follows a meeting we had in Helsinki at the end of August together with WHO and a government of Finland, where we discussed issues arising around mental health and well-being of the health and care workforce. We discussed from gender and equity in terms of, for instance, migrant health care workers across across European member states, but also violence and aggression on health and care workers, so that the whole spectrum of concerns around around healthcare as the workplace and what does that mean for the health and care workers was discussed and was put on the table. And as a result of that meeting, the call of today, launched today by WHO Europe, tries to bring together what we learned in that meeting in Helsinki. It is in the website, so if you are interested to see, you can find it in the WHO Europe website. And last but not least, it is not related to this topic, but also we launched today the toolkit to reduce stigma and discrimination in mental health. It has been launched today in the WHO Europe website, and it aims at being a tool at the hands of all those who want to get involved into programs to address stigma and discrimination. And I thought it would be important to bring it here because in all the meetings, in all the contacts we have with our colleagues in the region, we hear their concerns about, especially the mental health workforce, psychiatry, psychiatric nurses, about them as well being part of the stigma and discrimination around mental health that our patients also do experience. And with that, I would like to give you again a big thanks to Professor Christodoulou and colleagues in Athens for organizing this consistently, but also to express my appreciation for being in this honorable panel. Thank you.
Thank you, Lydia, for this factual and always interesting work that you have presented to us. Thank you very much. And now we will continue with Professor Emerita Nancy Papalexandri, who is former sub-dean of the Athens University for Economics and Business. And Nancy will speak about fighting burnout for better mental health in the workplace. Professor Papalexandri, please take the floor.
Hello, everybody. It's a deep honor and pleasure for me to be in this event. And I'm not a psychologist. I'm a person from human resource management. So I will try to explain to you why well-being and wellness and mental health of employees is a very, very crucial point which HR management is trying to address today. Professor Christodoulou and Professor Clousas spoke already about burnout, the signs of having it, and the stress which, as a rule, comes before the eventual appearance of burnout. Typical signs, I will allow me just to repeat very briefly. Typical signs of occupational burnout are that first, the person feels completely exhausted, is not willing to go to work. It's very difficult to get out of bed in the morning. The performance becomes very poor because the person cannot focus on the job. But even when the person finishes the job and goes back to work, back home, thoughts keep revolving around work, so the person cannot find peace. And also this comes along with various physical ailments, such as headaches, stomach aches, back aches, and eventually we can also see depression. Now, the statistics about burnout are unfortunately very dramatic, especially following the COVID-19. During a recent survey in 2023 in 6 Western countries, including the UK and USA, 42% of desk-based employees reported burnout, which is a very high percentage. Also, stress levels were exceptionally high, especially among young people who fear they have job insecurity. They don't know if they will continue having their job. And also women, especially women who are heads of single parent families. In many Western countries, unfortunately, there are gaps in pay, there are gaps in promotion, as we know, gender gaps, and also inaccessible childcare. Childcare is very expensive, so it's very difficult for single parent homes and women to cope. Now, jobs with the highest burnout rate is first project management, because you have to meet details, and sometimes this becomes very, very difficult. Healthcare services, we have already heard all the details about people in healthcare. Community and social services, and education. Also, educators face a lot of symptoms having to do with burnout. Now, which are the organizational factors which people in human resource management are trying to address? Because in HR, as in all other areas of management, we try to be sustainable, to apply the principles of sustainability. So sustainable HR means what? It means that you have to make sure that you preserve the well-being and the health of your employees. Of course, you don't do this only as a charity. You do it because the performance is very important if you want to keep running your business and be profitable and be able to offer employment. Now, which are the organizational risk factors? First, the heavy workload. This is very well understood. The next is lack of sufficient control over job resources. Many times you are asked to perform a job, but you are not given all the resources needed. You don't have adequate information. You don't have adequate collaboration with your colleagues who have to provide data to you. You don't have a good working electronic system. You don't have all these facilities which are necessary. Then another reason, very important, is lack of positive feedback and recognition from your supervisor. That is why it was already mentioned that the leadership style of people who are in the supervisory positions is very, very important. Then you have another reason is bad personal and team relations. If you have conflict, if you have an environment where relations are not good, then this is very, very bad. And overall, it decreases your capability of coping. Then you have a final thing is what we call conflict between personal and organizational values. In some companies, employees are asked either to deceive clients in order to be more profitable, to tell lies, to use false data. This is part of their job, actually, in some jobs. And on the other hand, this comes into conflict with values of certain people. Sometimes they may be obliged to do it in order to do their job, but this is very much against their well-being. Now, what can an organization do in order to fight burnout? The first is what we call employee survey or cultural audit. It has already been mentioned by Professor Christodoulou. We have to listen to what employees have to tell us. Employee surveys are surveys which are done anonymously, so employees can feel free to tell their opinion. And this can go together with a general audit of the whole company, where you can see in which departments there is more conflict, there is more stress, in which departments there is more absenteeism or presenteeism, something that Professor Christodoulou also mentioned. Presenteeism meaning just being present and not doing your work, not performing, and absenteeism, finding excuses all the time for not going to work. So both these things have to be reported, and what we call either employee survey, or sometimes we call it employee voice, or a cultural audit. What is the different ingredients of your organizational culture? Once you write this down, then you can decide which measures you can go and start facing the situation. The main goal is to create a supportive work environment. And what does this mean? A supportive work environment is an environment where first you have fair treatment of employees and you have also positive feedback. If an employee tries, you have to tell this. The supervisor has to tell this, has to acknowledge good performance. Also, fair treatment means that you apply principles of meritocracy. You don't favor certain persons or certain employees because they happen to be relatives or friends of friends or whatever. You have to be very fair. The next one is to try to train your leaders, supervisors, whichever element, whichever level. Now, in literature, we have a lot of evidence that many people reaching leadership positions, they themselves feel insecure, and this insecurity is expressed with negativism, with a lot of, let's say, bad behavior towards employees. And we have a lot has been written recently about toxic leadership, which means we have an employee which, while he is at the lower level, he or she behaves very well. But when this person gets promoted and has authority, this person becomes very toxic. And one of the reasons is what I mentioned before, insecurity, plus the pressure to appear good and perform and show to top management that I am, let's say, worthy of this promotion. So you have to train your leaders. You have to train your supervisors. You have to do some coaching. Leadership coaching is recently very much in fashion. You have to show them the way to lead, because not everyone is fit to become a supervisor or a leader. Then we have the flexible work arrangements, which have been practiced recently very much, especially after the pandemic, and work-life balance programs, which include, first of all, flexibility, and then different arrangements which have taken into consideration the needs of the employees. So when we talk about work-life balance, we have first to see which are the particular needs. Other needs, mothers with young children have other needs. People who are in, let's say, in another older age, have other needs. So you have to tailor-make this work-life balance and not do something which is horizontally fit for everybody. Wellness and well-being, a few companies provide exercise, fitness, provide lectures about mindfulness, meditation opportunities, and also what we call EAP, employee assistance programs, which means certain companies collaborate with these organizations which offer psychological and sociological support, and employees are encouraged to take a phone. There's a hotline 24 hours a day. You can report your problems anonymously and receive help from professionals. Now, so these are some of the organizational efforts, but on the other way, the person, the employee himself or herself, has to make sure that takes care of her or his needs. So as employees, the first thing is to understand signs and symptoms that burnout is arriving and practice self-care, that is exercise, enough sleep, good eating habits. It has already been mentioned. Also reach to those close to you for support. Talk to colleagues or to supervisors. Now, we know that recently there was a law enforced also in Greece. If you have a problem, let's say with workplace bullying, which is, I would say, quite often recently in work, companies have to appoint a person who is responsible and well-trained to receive all the complaints and see whether some measures can be taken. Also, if things do not work for you, look for another job. This is the final step, but it's better to do. I've, believe it or not, in my seminars with managers, from time to time, I came across people who quit their jobs. Even 2 or 3 times, they were people who worked in the civil service and they had tenure. So it was very difficult for them to take to make the decision and leave. But they left because they had, it was impossible to continue with the working conditions. And especially the style of the supervisor, the leadership, very, very important. So just to conclude, there are efforts must be taken from 3 parts. First, the individual. Then the organization, which has a lot of responsibility, especially large organizations. And third, society and the medical community. And this is why we are here today. And thank you very much for this very important event. Thank you.
Thank you. Thank you, Professor Papalexandri, for this extremely important input. I think it's very useful to listen to people who do not belong to the psychiatric, psychological, social work, and so on society, but come from elsewhere, because this feedback is very useful in the framework of this multidisciplinary attitude that we all should adopt, I believe. And now we come to the next speaker, who is Dušica Lezić-Tosevski, professor of psychiatry at the University of Belgrade, academician in the Academy of Sciences and Letters in Serbia. Yes, Spiro? Are we okay with Dušica?
Can you see my slides?
Yes.
Can you see my slides?
Yes.
Can you see my slides?
I don't think she has any slides.
Can you see my slides?
Do you have slides, Dušica?
Yes.
You do, eh?
Yes, I
do. Can you share?
I'm trying.
Take your time.
I can't find where is the share. Okay.
We'll discuss other things in the meantime.
One moment. Can you accept to become panelist?
Sorry?
Can you accept to be panelist?
Silent.
No, to be panelist. Can you accept?
Yes. I'm joining a
Now you can share.
I'm having my slides on the desktop, but I'm not able to share them. I don't know what to do, how to share them.
There's a green arrow that says share. You press on it.
Sorry?
You see a green arrow in the middle that says share.
Okay, share, yes.
You press that and then you pick what you want to share.
This one. Share. Is it okay now?
Okay.
Yes.
Perfecto.
Okay, can I speak? Is it
Yes,
okay?
yes, everything fine.
So, dear colleagues, αγαπητοί συνάδελφοι και φίλοι, Let me first thank Professor George Christodoulou for kindly inviting me to this important meeting. Ευχαριστώ πολύ, καθηγητή Christodoulou. Coming from a developing country, being a woman, and being a physician and psychiatrist, I will speak today about multiple roles of women physicians in developing countries. In order to do that, I will briefly cover times of stress, the consequences of times of stress, about women physicians and disasters, burnout syndrome, our study, and interventions. And it's obvious that I chose this subject because I come from a country, a developing country that faced major stressors in the last 30 years. So there are many consequences during times of stress, such as behavior and adjustment problems. Post-traumatic stress disorder exposure is about 25%, or 1/4 of persons in these times of stress develop this disorder. Consequences are much higher in vulnerable groups, and the risk is twofold higher in women. Passing through experiencing the spiral of stress, many illnesses can develop, as well as decreased quality of life. What is happening with women physicians during disasters? Of course, everyone is affected by disasters, but today I will speak only about women. The disasters initiate chronic, prolonged stress. And during the times of stress, we have to overwork. I myself worked more than ever during the times of stress and wrote more than ever. And I think it was my defense mechanism against feeling of hopelessness and a coping strategy with stress, not only mine, but of my colleagues as well. What we try to achieve with overwork is to find meaning at meaningless times. During the time of stress, there are multiple roles and responsibilities of female doctors. Many of them are teachers, leaders, managers. I could add some other issues. And by seeing this slide, I think it is almost my self-portrait. What are these multiple roles of women physicians in developing countries? Women have double role, of course, most of them, but during the time of disasters, they have an additional third component. We had to initiate and lead programs for refugees and other vulnerable groups to work with traumatized individuals, not only us, but many women colleagues all over the world. Unfortunately, disasters are happening all over the world. Working with traumatized individuals causes secondary traumatization of those of helpers. And of course, there are limited resources in developing countries because we share difficult destiny with our patients. And as a consequence, we might develop, or women might develop, burnout syndrome, about which we've already heard about today. Burnout syndrome is a key factor, cause of the burnout syndrome is stress, because there are many decision-making responsibilities of women, and decision-making responsibilities are the major sources of stress. I could add here that a new source of stress are these online conferences, especially of those whose computers don't behave as mine did yesterday. Then there is a workload and shortage of time, and a specific role strain of female doctors, which affects women, and which are health risks that reduce life expectancy and also might accelerate aging, as Professor Crouzos has said today. The aim of our study, it was a large study on burnout. I'm showing just a smaller part of it due to the shortage of time. The aim was to assess the burnout syndrome of physicians in Serbia, Bosnia, and Norway. Why Bosnia? Because Serbia and Bosnia were countries in conflict before. And why Norway? Because during collaboration with our colleagues in Bosnia, and not only Bosnia, we had a very good support, continuous support by Committee for Human Rights. So we wanted to see what is the burnout in two developing countries and one developed country. The purpose of the study was, of course, a research one, but also conflict resolution and reconciliation. Our sample consisted, this part of our study consisted of 111 physicians, 74 of which were female. Mean age was about 40 years. And we included 31 general practitioners from Sarajevo, capital of Bosnia, 41 from Oslo, and 39 from Belgrade, from where I come from. We used Maslach burnout inventory, which has three components to be measured, as we already heard today: emotional exhaustion, depersonalization, and reduced personal accomplishment. And what were our results? Emotional exhaustion and depersonalization were much higher in female. And of course, the results have shown that they were much higher in developing countries, which was an expected result because Norway is a highly developed country. So our results have shown that there is a gender difference in burnout. Female general practitioners have higher emotional exhaustions and depersonalization than male. There was, as expected, as I said, a higher burnout in developing countries. And what we also found, that there was a significant correlation between number of patients and emotional exhaustion, because most of women physicians, including psychiatrists, have many patients to take care about during the day, in addition to other tasks that I mentioned in my previous slides. We have published our results in World Psychiatry and some other journals. And finally, at the end, I will briefly say that interventions are, of course, important. What is important? To identify individuals with a tendency towards development of burnout, to initiate preventive measures such as stress management and improvement of stress coping strategies. And I will end here, thanking you very much for your attention. Ευχαριστώ πολύ.
Anything happening?
So we go on with the.
Yes, I finished.
Has been the president of the World Psychiatric Association and the European Psychiatric Association, in addition to various other distinctions and titles. Norman is well known to every psychiatrist in Greece and everywhere in the world. So we look forward to his topic, which I think is of extreme importance.
Thank you very much.
Hidden workplace, normal, which is a neglected area. I have had the chance to mention something about this in my introduction, but we look forward to what we have to say on this interesting topic.
Thank you very much. Thank you for the invitation, and I join Juan Enrique Message and others who have expressed admiration for organizing this meeting on regular intervals. I hope that sometime you can put all of these webinars together and maybe have them preserved somewhere. I'm sure that the World Psychiatric Association website would be one of the places where they could be very well preserved. I decided that I would speak about the forgotten workplace, about the carer's life. Now, why do I say this? I think that we have to think a little bit about the socioeconomic changes in recent years. And I've listed some of them, which I believe are of particular importance for burnout, but also for the breakdown of people who are particularly carers, but also others. We have seen the fragmentation of labor, which has first been described in France in the 1930s, but meanwhile is present everywhere, where people, labor has been fragmented into so many small pieces that in fact nobody has the feeling of achieving anything. A shoemaker, when he produces a shoe, sees a shoe in his hands. But what happens now at industry was his first, was the chain work. But we have also in medicine and elsewhere become chain workers. We see only one piece, one small piece of our work. We rarely see the total product of it. And I think that that is something. Pollution is another important factor which leads to a variety of diseases which are really important. The epidemic of substance abuse. All of these are very big problems, but there is one more additional one, of course, which we say that medicine has been so successful because it prolonged the life of people with mental and physical disorders. But the prolongation of life have not been healthy years. These have been years in which people suffer from illnesses. In the past century, particularly in the 1930s to 70s, there was a lot of emphasis on community care. And we have been very proud in many places to be able to close the mental hospitals and transfer the care into the care of their homes. The problem, however, is that the emphasis on community and transferring these people to their homes has not made life easier for them, in view of the fact in particular that a number of families have become reduced in size. And what is also more, the families as such have started to break up in what has been called the process of horizontalization, where people, children speak to children, adolescents speak to adolescents, etc. And the family as such as a structure has been broken apart. There's also the instability of marriage, which has been another factor that has played some role, leaving people separated, but leaving also the problem of looking after an elderly relative or a sick person in the family much more difficult than was ever the case. And so I think that has been, all of this leads to an increase of risk for mental illness and for physical illness of carers. In fact, it has been demonstrated that, for example, in Australia and in other places, that carers have a significantly higher rate of physical illness and of mental illness than the normal population. That is where I say normal, I mean the population which is not having somebody for whom they've taken full care. They've significantly also higher levels of burnout. I think that in addition, we have also seen, and it was thought that maybe digitalization will bring some help because people will be in contact care, etc., and that might play an important and useful role. But unfortunately, digitalization has been reserved for those who have more money, and many of the poor and the elderly have not been helped very much by digitalization and remained as a burden in their families. Urbanization as such has also brought an important additional factor. In some countries have become so urbanized that, in fact, nobody's left in the villages. Argentina, for example, has 95% of the population in urban cities. And what is more, these 95% have come to town in the last 20 or 30 years, which means that in fact, they don't know each other. They do not know the neighbors with whom they are, and they cannot count on other members of a non-existent community. So unstable families, which are reduced in size, horizontalization, that is the breakup of the relationship and the reduction of social capital, as well as urbanization, have all acted to make the burden that a carer who wants to look after somebody becomes so very difficult. And we see some consequences of this, even in countries which have been very proud of being for a long time models of looking after, for example, the elderly. China, for example, had to pass legislation last year because so many sons and daughters have left their parents, although they live in the same town, have left them alone and do not look after them. And even a country which is as poor as Bangladesh has in fact had the same law, because children are not looking after the elderly. Even when these elderly are not having any illness, the problems become even more serious when an elderly person carries with him also an illness, which reduces his capacity to see, his capacity to talk, his capacity to think. So I think that are all developments that are worldwide and put extra burden on the carers. Now, I think that we have to be very serious. The priority today for the World Mental Health programs is, in fact, to put carers at one very high place for our intervention. First, we should recognize their contribution. When we speak about who is looking after mental ill, we shouldn't say psychiatric services. In fact, in most places of the world, it's the carers who look after people who have mental illness, carers who look after people who have other illnesses or who are comorbid with more than one illness. So first, we should recognize this. There's only one country, the United Kingdom, which has an annual recognition of the family that of a family that has given particularly good care to a person who is mentally unwell. But we should think of recognizing them properly when we speak. And we should say that the care of this person has been, in fact, carried by these different partners, carers, as well as the doctors or service people and the patients. We should listen to their advice. There are very few countries in which, in planning health services, the word of carers is regularly sought, not only sought, but also listened to and acted upon. And I think that that is another important area. We have done a survey in which we wanted to see to what an extent the carers provide advice about structure of services, and discovered that the advice which they gave was incomparably more practical and useful than the advice that had been given by our colleagues in the medical field. We should also think very carefully about providing the material support. We have saved money by closing a bed in the hospital. Where is the money gone? It should follow the patient, which means that at least part of the expenses, the extra expenses that a family has by looking after the patient should in fact be given to them in cash now. I think it's very important that we think about it very carefully. At a time where many things can be purchased and all things can be sold, we should think of ways in which we can help the family carry, or not the family, a friend, to carry, to get some extra support, to be in some way seen. There are some, it's not only that we should give them some material support in this way. In Holland, for example, I find a wonderful arrangement is that a person who is severely disabled can be put in hospital not because he's more ill than before, but just because for a fortnight his family should go on a holiday without that very ill person to get a bit of strength again. Of course, this is a use of a hospital bed. It's money, but I think it's very important if you think of reserving cash and other support to the carers worldwide. We should also think about the enormous knowledge which they have and invite them and come and teach us, to teach medical students about what care is like and what it should be done and how it should be done. Because they know it, they live with patients all day long, they know what care means and they should do it. For example, we should also have a questionnaire, if you wish, or a standard way before a person is discharged to fill in what are the characteristics of the carer at home. And if there is no carer, what can we create in order to be a recipient which will help the person survive. And I think that we should make sure that our carers are also participating in the training of medical doctors to enable them to build a new relationship, because they will see whether that is fine. Many doctors do it, they ask, but very often the policy as such is not yet open to what I'm describing. So, dear listeners, ladies and gentlemen, I think that I want to really stress that carers are essential partners in health services, and efforts to offer a life of acceptable quality to them is absolutely a priority. I think we need to give more attention to what happens at the workplace and to their needs. And we should think, when we are planning for healthcare for the future, what is it that we have to give to the patient, to the people who work in the healthcare service, including people who are called carers and who are not paid their salary to look after people. They're doing it for love and for friendship, but they also have to be helped if they are to survive themselves, if they are to remain healthy, and if they are not going to burn out. Thank you very much for your attention. Ja, mislim, da se ćemo. Ne znam kaj se dešava.
General health care. So this topic will be dealt further by Spiros Zorbas, who is the president of the Association of Carers in Greece, called Epioni. So Spiro, please go ahead. Thank you, Norman.
Thank you very much, Professor Sartorius, for your participation. It's an honor to have you with us. My name is Spiros Zorbas. I'm a former informal family caregiver. It's an honor to discuss a subject very close to my heart, the contribution of carers to the well-being of people with mental health problems. As somebody who had a family member who has been a family caregiver for a loved one with severe mental health challenges, I have firsthand I have seen the immense impact of carers that have in the well-being of those they care for. Caring for somebody with mental health problems is a journey that requires patience, resilience, and compassion. It's not just about helping someone get through the day, it's about treating an environment where they can thrive. We carers play a crucial role in ensuring that our loved ones maintain a sense of stability, feel supported, and are given the opportunity to heal and recover. But beyond the emotional support, carers often serve as advocates for those they care for. We navigate complex healthcare systems, coordinate treatments, and ensure that our loved ones have access to the resources they need. This can be overwhelming, but it is essential because the quality of care and the continuity of support can make all the difference in the recovery process. Carers are often the ones who understand the daily rhythms of those we care for, their needs, their triggers, and their progress. Our contribution is not only practical, but deeply relational. We provide a sense of security, helping to reduce feelings of isolation and fear, and the importance of carers in this field cannot be overstated. While mental health professionals are indispensable, carers fill the gaps that often exist between therapy sessions, hospital visits, and medication management. We are there during the everyday moments, the good, the challenging, and the in-between, helping to create a foundation of consistency that is so vital for mental health recovery. Yet, despite our vital role, carers often go unnoticed, our contributions underestimated. This needs to change. It's crucial that we as a society recognize and value the work that carers do, and that we provide them with the support they need, whether it be through respite services, mental health training, or financial assistance. Our contribution is not just about helping our loved ones survive their challenges, it's about empowering them to live their lives to the fullest with dignity and hope. And in doing so, carers themselves should not be left behind. We too need support for our well-being, as the responsibility we carry is significant. I'm proud to be part of this community of carers, and I hope that through greater awareness, our role will be better supported and appreciated. Thank you very much. And now we have a discussion. It's an honor to have with us George Ikos. And the floor is yours.
The honor is all mine,
George
Mr.
Ikos is Emeritus Professor of Psychiatry, and yes.
Thank you. The honor is all mine, and what a day it has been. I can't help feeling that I have been favored with this invitation because of my friendship with both George and Nikos Christodoulou. I have learned a lot from every single talk, actually, and it is impossible to summarize those. And really, I've been in very distinguished company. I was reminded this morning when I was doing a search that Professor Sartorius first published the WHO schizophrenia study 50 years ago, one of the most influential studies in psychiatry. I think last year was the 50th anniversary. A lot has been covered, and perhaps it's been a mistake to invite me to close such an event, because I am working at the moment on an attitude for psychiatrists, which I summarize under the phrase dialectical pessimism. Why dialectical pessimism, and what does it mean? Because in many ways, things have got worse, and it is not an accident. It's a systemic thing, and some of the stresses and strains have been touched by the previous presenters. Yes, a lot of people got richer, and some things have got better, but there is a population, a large population that have suffered, and actually within that population, those that are stressed at work may be considered the more fortunate compared to the unemployed, the refugees, the asylum seekers, some of whom are very highly skilled indeed. So I think part of what we really need to be alert to is an enlightened disenchantment with society that takes account for reality. But we don't need to be hopeless. I think what I have seen today is what I would say a vocational passion or even utopia, a utopian ambition for psychiatry. And I will restrict myself to speaking about psychiatry because that's what I do clinically still. When I co-edited the social history of psychiatry in Britain between 1960 and 2010 with my dear friend, colleague, collaborator, and mentor, Nick Burras, we were struck by two things. First, that social factors had had a greater impact on the practice of psychiatry during those decades than biomedical research. And second, that the mental health services did some good, no doubt, but along with other health services, they seemed to be better placed to serve the needs of capital. Now, this may sound to you extreme, but it's an important point that can help explain the current levels of stress and distress and social exclusion and burden on carers that we have been talking about. Because this actually is not accidentally. If you read social sciences classics like Karl Polanyi's The Great Transformation, you will see that our societies, Western societies, gave their center to the economy, to the market specifically. And this it was tempered with trade unions originally, then with a welfare state, but then in what is called the neoliberal era, those have been rolled back. And we have, because of that specifically, because of the pursuit of profit and the need for capital to constantly speed up and occupy greater spaces in the world quicker, we get the experiences of people at work and equally importantly, people that are marginalized because they fail at work and act as a warning to those that are working but are anxious about losing their job, and then people that are excluded. So part of my argument is that the strain on performance really, and that goes very deep in terms of profit, but also goes in international competition. At the end, the competition in economy and wealth is a competition about arms, hegemony, and domination, and is very difficult to shake, but is actually very impactful on the daily lives of working people and those excluded from work. In a way, I said we've been talking about the privileged people. One of the things that has grown in the last 4 decades or so is incarceration, massive incarceration, particularly of Black people, not only in the United States. I was told that in the United Kingdom, a higher proportion of Blacks are in prison and institutions than in the United States. And the question arises, how do we prepare those people for work? Do we prepare people for work? In fact, people are thrown on the streets. This is a particularly acute problem in Britain at the moment because we don't have places for new prisoners. And what I think as psychiatrists is we need to be aware of these tensions. And I'll say 2 more things and we'll stop. The first thing is I'm worried about the position of psychiatry in society. And I'm referring here to the increasing anxiety of young people about concentration and ADHD. What are psychiatrists doing here? Are they treating an illness Are they treating a clinical syndrome, or are we medicating people that feel they have to perform better and better and faster? I think we need to think about that very hard. I'm not saying that some kids don't need medication for ADHD. I think they do, but I think there's something else going on as well. The second thing I would say in trying to draw lessons for psychiatrists is we need to take increased interest in what some call subaltern population, not those that work in the corporations or the governments that run our world, but people that are marginalized, excluded. Some of them have chosen not to work. And I think that sometimes is the best change for them. Perhaps their gatherings, their communities represent breathing space for young people that is not available to them in the highly structured world. The other thing I would say, yes, we need to be thinking about work and it's important, but we also need to be thinking about benefits for those people that cannot work because of mental illness. Thank you.
Thoughtful talk. We'll have the chance to discuss these things a little bit later after Professor Nikos Christodoulou, the second discussant, offers his input.
Okay, thank you. So I will start unconventionally by reintroducing Professor Rikos, who was one of my dear friends in the UK and mentors in the UK in earlier years. So I'm really glad to see him on the screen. So that's a post-talk introduction. Before I go on to summarize a few points that were heard today, very interesting points by all the speakers. To start with, the introduction by Professor Christodoulou, who mentioned workplace and the necessity to look after people at the workplace and listen to them. It's good to think about the workplace and how things work out at the workplace as a marathon as opposed to as a continuous sprint. This was underlined by Professor Papalexandri as well. It is important to set the scene and to take care of the circumstances so that people manage to work at a workplace with good feelings and under good circumstances. Otherwise, productivity will drop and people will quit. So listen to them and give them the right conditions to work. That is especially important when it comes to what Professor Sartorius and Professor Epigaro mentioned, as well as Professor Lečić. It is people who work in unconventional places. In fact, there are some people who work in places where work, in inverted commas, is not a word found in what they do. I'm talking about people who look after infirm relatives and people who cannot look after themselves at home. I'm referring to mothers looking after their babies. That is particularly taxing work, which also contributes to burnout. That is not supervised by a human resources department. That is not managed by a compassionate manager. It is work that is done in silence. It's work that is done it is forgotten work, as Professor Sartorius put it. So besides the workplace, there are hidden workplaces, and we have to keep that in mind. An important hidden workplace, which came up in Professor Papalexandris' talk was the hidden workplace of managers and leaders. They don't often have the luxury of being able to share different stressors, and it is very common, a common occurrence that they suffer burnout, which is very hard to deal with. And that is important because if it is not dealt with, then it can often seep to the employees, and it's important, and it can often get diffused down the line of the pecking order of a workplace. So that dealing with burnout for managers and leaders, that's also a hidden burnout factor that needs to be looked at. Then going to Professor Chrousos' talk, he spoke about personal accomplishment imbalance, which also links with leadership and management burnout. That accomplishment imbalance is a very important factor, and it's one of the few evidence-based factors that we have links to burnout. That factor has the advantage of being able to be dealt with. And by that I mean not prospectively. It is one of the factors that can be dealt with when it is detected. Many of the factors that are evidence-based linked to burnout have to do with personality, they have to do with past circumstances, they have to do with current circumstances like financial circumstances, which are not easy to be dealt with. However, the personal accomplishment imbalance that is often found in workplaces can be dealt with, and it can be dealt with by setting up the system so that it can be effective and to reflect the effort that one puts in. So it is important, especially because it can be tweaked, as opposed to other factors that cannot be tweaked. That links very well with something that Professor Sartorius went on to talk about. No, actually, Professor Chrousos talked about. He talked about resilience, and he talked about factors that relate with recovery. He showed us a graph, which is the same graph as the resilience that characterizes materials in physics and systems when it comes to natural or systemic disasters. There is a phase that everyone goes through when they have a disaster or a traumatic event, where they lose capacity, they lose functional capacity, and then after a while they recover. The degree to which they recover is directly related to the level of resilience that they have as a person. In fact, in the graph that Professor Chrousos showed us, it is the area under the graph, the integral, that reflects resilience, and it is characterized by a certain equation in physics. That equation is very easy to describe in physics, but very hard to describe in mental health. And that is the complexity that we're faced with. We're faced with a complexity that resilience cannot be defined or affected by many different factors. And going back to the personal accomplishment imbalance, that's one of the factors that can affect resilience. So it is an important factor to look at. Looking at what Professor Papalexandri and Professor Chrousos mentioned about persistent physical symptoms or medically unexplained symptoms. Well, we do have a lot of those recently. We know that in the last 20 years, those have gone up from 10% to about 25 to 49% in different populations in primary care. So psychosomatic expression of stress are rampant, and resilience comes into that equation as well. Thalys said, who is happy? Τις ευδαίμων. The person that has a healthy body, soma υγιές, a rich soul, ψυχή εύπορος, and a flexible, adaptable, or resilient nature, who is φύση ευπαίδευτος. So resilience is great not only for burnout at the workplace, but it's also great for dealing with psychosomatic problems, which are often coexist with burnout, as we know. Moving on, and I'm going to be quick now because I realize that you're all very tired. Moving on to Professor Mesic's approach. That, I think, is probably the most quintessential approach when it comes to dealing with burnout. He talked about mental health, looking after one's mental health, being not one of the important aspects, but the most critical aspect of general well-being. General well-being, not just mental well-being. In fact, what I realized from his talk was that it is an actual prerequisite to having general well-being. It is not just the most critical factor, it's a prerequisite. And that is reflected by recent evidence. We worked in a dementia guideline for exercise and its use in the prevention of dementia, secondary and tertiary prevention of dementia. Those guidelines turned out to be a flop. In fact, exercise doesn't really prevent dementia. The only reason why we rated exercise as a must for preventing dementia was the mental health effects that exercise had in preventing dementia. So, linking with what Professor Mesic said, general well-being, yes, is dependent. In fact, mental health is a prerequisite for it. Then Professor Lazzeri mentioned that there isn't much evidence about the mental health and economic interface in terms of preventing mental health preventing burnout at the workplace. There is very scant evidence, but there is some. There is a study done by the London School of Economics. It's now about maybe 15 years old. And what it said was that if you install someone who's, by the way, those are models, they haven't been tested, but economic models are often not tested, so there we go. If you install a psychologist or a mental health worker delivering cognitive behavioral-like interventions, not typical CBT, but in essence, CBT-like interventions, then you get a loss in the first year because you have to pay that person to deliver those interventions, but the return on investment is evident from the second year on. So there is some evidence to suggest that burnout at the workplace can be prevented by mental health interventions. Having said that, those are models. They're very UK based, so they're culture specific, and they need to be expanded. But there is some evidence to suggest that there may be something there in terms of cost effectiveness. There is also this other work that mentions that in mental health, only 15% of investment returns as direct cost cutting. The rest of the investment is invisible, and it refers to the 85% of personal costs and operational procedural costs. So it is important to bear that in mind as well. Going back to Professor Papalexandri's talk, she talked about the
the attrition that's, well, not in those words, but this is how I perceived it. The attrition that one gets as a leadership figure in an organization or a service. And that is again, the accomplishment imbalance that Professor Chrousos mentioned earlier. But the other thing that came to mind when listening to Professor Papalexandri is who has the skill set, who is able to be a leader and a manager in a service. That skill set is mental health related. You have to be able to reflect. You have to be able to have empathy. You have to be able to withstand pressure without, even if you feel it, without radiating it to others. So that skill set is very special. And of course, nobody has it without developing it. And then last but not least, I'm going to unconventionally again close by, well, actually, let me just say something about Professor Sartorius's talk that linked to, he said repeatedly, listen to people, which is what Professor Christodoulou said in his introduction, and also Spyros Zorbas said in his talk. So you have to listen to the carers, you have to listen to the people who provide, and you have to listen to the people who have burnout. And so I will unconventionally close by commenting on my fellow commentator, Professor Ikos, on his point of pessimism, which is an interesting point, and there is a lot of pessimism because the events and the evidence around us dictate it. But that triggered a thought, which thought in me, which was that the answer to that pessimism is prevention. So what we're seeing repeatedly is when things go bad, when things, well, when there is a disaster, when there is a dire need for psychiatry to intervene, then things are really bad because you cannot do much in retrospect. The retroscope is not very useful in those circumstances. Lydia Lazeri called that the trivialization of psychiatry. When something happens, you call on the psychiatrist and you say, go on, fix it. And that's not something you can do. You're faced with the absolute pessimism there. There's nothing you can do. And what you say there is, I wish you'd listened to me when I told you years ago that if you prevented this, then none of this would have happened. So the answer to that, to the present pessimism, is a preventive logic which should have been applied years ago. But, and I will close with this, the present moment is the moment to apply prevention for the future pessimistic Professor Ikos. Thank you.
I wish to thank both commentators, discussants, for their thoughtful contributions. Of course, we have taken more time than originally scheduled, about 1 hour more. I accept responsibility for this, but I think all talks were so interesting that they could not be interrupted. So I apologize for this, and I congratulate you for having the patience to remain in this space here and on your computers to attend all these meetings. I think it was a very interesting meeting, and I want to congratulate all distinguished speakers for their input. And I hope that we'll meet next year in the World Mental Health Day again. And for now, goodbye to all, and thank you very much.